I'm from the Philippines originally. I came here when I was about 7 years old, and I went around multiple places because my father was in the military, in the Air Force. So we actually were in South Carolina the longest, and that's where I went to undergrad. I did pharmacy there, then went to medical school there, and then did a residency in internal medicine in Alabama. I was in private practice for a couple of years, then went into the VA, and after a few years, I decided to go back into to do a hematology oncology fellowship, which I did in East Carolina. So now I'm here. Well, it's pronounced as Wenimar Salvador. Actually, it is. It's a derivative of the first three letters of my grandfather's, Wenceslao and Marshall. And my dad added an I in the middle to make it sound better. So it's Wenimar. It's not. It doesn't mean anything, but it's a nice little new thing about, or at least a new way of making names to get both my grandfathers in. Well, it's several things. One, I wanted to do a subspecialty after internal medicine. I wanted to learn a little bit more about a couple of a particular place or particular field in internal medicine. And it was a toss-up between gastroenterology and hematology oncology. What got me over the hump was, my mom did have breast cancer, and she passed away from breast cancer during, in fact, just after I finished my internal medicine residency. So it hit home, and I wanted to give a little bit back to people who have cancer. Oh, I pretty much fell in love with it the first time I came here. It's a nice small town. That's really what my wife and I talked about is where to raise our kids. We've been through the big cities. It's too hectic, not very personable. It's not where we want to raise our kids. We wanted to raise our kids in a nice community that values family. And I saw that the first time I came over here. Everybody was very personal, kind of a family atmosphere. And it also helps that it's very scenic here, and it's a very nice part of the state. The activities here are also things that we want to do. My family likes to be on the outdoors, and it pretty much fits it. I think what kind of hit it home with at least my wife and my family was the pink ribbon activity that we went to when I was coming here for the second time. Everybody was so personable and made us feel like home, and that pretty much knocked it home for us, at least for me and my wife and my family. One thing I noticed in this area is the family support is much better, and I think that has to do with a big academic setting versus a community setting. And what I noticed is most of the patients have very strong family support. You don't see that all the time, at least where I came from. And there's so much, and that's key to having a good relationship and actually having good care, because you're going to need all the family support to bring you to appointments, to bring you to tests, and to help take care of you once you're sick, and also to bring you back, so to get you better. So that's one thing I noticed that is huge here in this community. The cancer center itself is great. I can't speak enough of it. The staff are very very personable. They help us, at least they help me a lot to get into working and getting familiar with how they do things. But the thing that I get out of it again is more the family atmosphere, and I get that with the staff. They're just very friendly, and they treat all the patients and and the personnel is family. They're very fun to work with. I really have a good time, working with them. It's not a professional. It's more of maybe a brother to brother type of relationship. I could always go to them at any time, since certainly I'm coming out of fellowship. I don't have as much experience as these guys, and they took me under their wing and helped me out whenever I need it. We can provide everything that they need. Certainly, certain services like transplant will have to go over there, but we can provide everything else that they need here. There's no point in having to travel so long, especially if they're sick, to be able to get care that they can get here, because the care that we provide here is standard of care. It's what they offer in the big places, other than very specialized type services. And at some point, we'll get a few more of those, but I think we provide a lot of standard of care. We can provide anything that those big centers can, with very few exceptions. Cancer, the diagnosis, people always write off as something that is fatal very soon, very quickly. And the way cancer treatment is now, we're keeping people alive much longer. And many diseases that people died of many years ago have become more of a chronic disease, like high blood pressure, which we can control with many different medications and keep them alive longer. And that helps out with quality of life issues as well. But we're making a lot of advances in a lot of cancers that really are fatal in a short period of time. We're keeping people alive longer, and that's unheard of even 5 years ago. Now we have medications that will change the biology and keep people alive a very long time. We're kind of in an era where we're targeting particular processes within the cancer cells. It's not traditional chemotherapy anymore, where we just give you a lot of poisons and hope cancer cells die. The trend nowadays is finding particular molecular targets or cell targets that are a lot less as far as side effect wise, and they will certainly have some side effects, but not in the traditional chemotherapy sense. And we've done much better with nausea and vomiting and things like that. That's pretty much unheard of nowadays with our medications. So it's become more scientific, more science fiction type nowadays. It's not the traditional chemotherapy where you get sick, stay in the hospital, and try to recover for your next round. It's become more treatment that you can take as an outpatient. You can go home, be in the confines of home rather than being in a hospital. I really am excited to be here as far as being the new physician in the community, and what I want to contribute is my expertise and try to treat people and treat people the way they want to be treated, as a person rather than as a patient. And that's at least what we bring here at the Grace community, as well as the Valdese communities, is we bring personalized care. We care about the person rather than just a patient with a number. So that's what I want to bring here, and that's what I want to bring as the new hematologist and oncologist here.